cases showing up or testing positive within the population. And that's also reflected in that dotted line, which is the rolling average over that time frame, and that trends downwards. If you look at the data as it is reported, aggregated on a weekly basis, we are seeing a similar pattern, shorter and shorter bars moving to the right, the blue bars being the month of June, that fuchsia bar being the first week in the month of July. What we will note is that when this week is finished, we'll be just about even, just about the same number of cases this week as last week, so that while the bars were getting shorter, there's a little bit of a plateau between last week and this week. And the positivity, which is that number of cases testing positive for every 100 samples tested for COVID, that positivity rate has gone back to about 30%, whereas it had dipped to about 26% in the week before. So those are things to keep an eye on, but overall the downward trend has continued to manifest itself, albeit slowly. Looking at the same data aggregated on a monthly basis, we see that we have decreased from the high of 13,085 in May down through June with nearly 8,900 cases. We are currently at 1,609 for the month of July, and at that pace, we expect the month of July should, if things continue as they are, should accumulate fewer cases than the month of June. The age-sex distribution has finally hit that, what we call the sweet spot, just being 50-50 exactly for the time being, males versus females. The 52% of those being in the 25 to 49 age group remains consistent. That's the majority. Again, as we've pointed out, we have seen that sort of an increase in the 60 and over that's been slowly manifesting itself throughout the peak of this pandemic, throughout the peak of our experience with it, through May, June, into July. And we're keeping an eye on that because we do know that persons who are in the older age groups tend to have more of the fatal outcomes, and that is a source of concern. It's a source of encouragement to get vaccinated, and we want to make sure that everybody understands the importance of that as we move forward. Looking at the distribution of age and sex among the fatalities, again, we're seeing that it's about a 60-40 or 59-41 distribution of males to females, and we're seeing that, again, the over 60 being the majority, but we're seeing that top right-hand pink bar, which is the females over 85, extending a little more than it had been in previous pyramids of this nature. Again, just highlighting the distribution among some of the older members of the population. And again, this is one of the causes of concern, and this is why we want to encourage as many people as possible to take up the vaccination, which reduces your risk of serious illness and death. And looking at the projections that we had made, just going back through this graph from the start, the blue lines, or the blue bars rather, are the cumulative totals day by day, and we're looking at them starting from the 1st of March, coming all the way through to yesterday, the 9th of July. What we did is at different points in time, we basically extrapolated forward how many cases we expected to get going at the rate we were going at. The green one, the green bar, was really at the rate we were going at the second half of April. If we continued at that rate, we'd have followed that sort of trajectory. The orange one being sort of middle May, May 12th to May 26th. If we'd continued at that rate, then that's the sort of trajectory in terms of cumulative cases we would have seen. We noted that in both of those, we had significant slowing, and we moved away from those projections to the point that we redid projections a little later. And just looking at the last projection, utilizing the data and the rates that we're going at from June 3rd to 17th, we see that we've basically continued along that pace. There hasn't been significant slowing. There's been some slowing, but it's very moderate in that time frame. So we're seeing that we're continuing at what we could consider to be a steady pace of decline. The pace of decline hasn't picked up, and this is where we are at this point in time with respect to the last set of projections. So that brings me to the end of the epidemiologic update. I'm going to turn you over to Dr. Richards for the clinical update.
Good afternoon to the Honourable Prime Minister, the Honourable Ministers of Health, National Security, Energy, and the Office of the Prime Minister. This afternoon, I'd like to also recognize the members of the media, my colleagues, the medical team, led by Dr. Roshan Parasram, members of the listening and viewing public. Today, I'd like to provide a status update on the status of the hospitals within the parallel healthcare system as of 8 a.m. on July 10, 2021. The parallel healthcare system now consists of 16 institutions, of which 14 are in Trinidad and Tobago and 2 are in Trinidad and 2 are in Tobago, and 9 hospitals for critically and ill severe patients and 7 for recovering or step-down patients. The bed capacity is approximately 1,022, but this is a dynamic situation. As Dr. Hines would have indicated, the rolling average, which is the average number of cases per day, continues to decline. This is an important measure because it predicts the need for hospital beds, within a 3 to 5 day span. We continue to notice a consistent decrease and narrowing in the hospital net admissions. And you would notice that the spaces between the orange line and the green line have narrowed significantly since the increase in cases on or about the 18th of April. This can be interpreted as a positive sign because it demonstrates a decreased burden on the parallel healthcare system. If we broke down the total number of admissions, and this is an actual number which we are looking at, total number of admissions and discharges per week, we would notice in the blue bar that there has been a general decrease in the number of patients being admitted across the 16 facilities. And since the 13th of June, this has been a consistent trend. We have also noticed a consistent decrease in the increase in the number of patients that are being discharged. And this trend has been occurring over the past month, since about the 13th of June. This again is a positive sign because it means that the additional number of patients in the parallel healthcare system per week is decreasing. The actual number of extra patients in the parallel healthcare system has decreased significantly between last week and this week. And this trend of decreasing admissions or net admissions has been occurring since on or about the 6th of July, so over the last 5 weeks. The difference or additional patients in the parallel healthcare system decreased by 67 persons. And that's a very positive sign because it means that more persons are being discharged, less persons are being admitted, and there is capacity in the parallel healthcare system to manage our severe and critically ill relatives and nationals. This graph shows in the red the actual number of COVID-positive patients that are hospitalized in the parallel healthcare system. And it shows the sum or the total of patients in the 9 hospitals and the 7 step-down facilities. Now, this is an important indicator because it shows numbers, not necessarily occupancy, and it's independent of the additional facilities we would have been adding over the last 3 months. This morning, there were 438 patients across 16 facilities, and this number has been consistently decreasing over the past month. Now, I'd like to note that this has been generally a very slow increase, and we have 326 patients in the hospitals that care for severe and critical patients, and 112 in the step-down facilities that care for recovering patients. This shows that the proportion of patients, that is 326 versus 112, continues to be high. So there are 3 times more severe and critical patients than the ones that are recovering. And it shows that this virus is extremely severe, and there's a need for additional resources between the ill patients in hospital and the recovering patients. Another measure we use is the occupancy, which is the total number of patients in hospital over the number of beds that are available. And that gives us an idea of the capacity of the parallel healthcare system, especially when it is concerned with the response, or the health sector response to COVID-19. You would notice a red line, which is the critical occupancy level of 75%, which was met in the middle of May. And since on or about the 28th of May, there has been yet another slow decline in the occupancy of persons in the parallel healthcare system. This morning, we have noticed the lowest occupancy since April, which is 42%. So between Trinidad and Tobago, 4 out of 10 beds are occupied by COVID-positive patients. We have also looked at the occupancy broken down between Trinidad and Tobago. In Trinidad, there are 14 hospitals and step-down facilities. In Tobago, there are 2. You would notice that yet again, the occupancy or percentage of persons requiring COVID care over the number of available beds has decreased from on or about the 28th of May, but in a generally a very slow manner. At present, the occupancy for Trinidad and Tobago is 44%, while for Tobago it is 23%. And again, a very slow decline from last week, Saturday to now. Now, these are the hospitals that the critical and severe patients in Trinidad and Tobago are admitted to. These are the hospitals where we require more resources. Again, a bed is not a bed, so nurses, doctors, ventilators. And the trend that we are seeing here is that the number of patients in these hospitals has been decreasing weekly. As of this week, the only hospital which is in the orange band is above that 75% threshold, and it's actually at 77%, so just barely above, is the Augustus Long Hospital. And this is our smallest hospital, and it services a very large catchment population with ICU and HDU, so that can account for the marginally increased percentage. We also manage 3 levels of patients in the parallel healthcare system. Level 1, severely and critically ill. Then level 2, high dependency unit, which is a step between the ward unit patients and the intensive care unit patients. And there's an ability to transition between the need for beds based on the demand for bed care, again, associated with the clinical status of the patient. Now, what you would notice is that the ward level beds, which are for the least ill patients, continues to decrease. And this morning it was at 38%, again one of the lowest occupancies since early or mid-April. Now, I would like to point out that the ICU occupancy continues to be high at 98%. And if we looked at the average ICU occupancy from the 1st of June to today, it's actually 82%, meaning at minimum and on average, 8 out of 10 ICU beds that have been operationalized at our hospitals are filled. Now, this does not mean that these are all the beds we have. We do have additional resources that can be operationalized, like ventilators, to manage the critically ill patients. The high dependency units, which is the second level of care and the intermediate level of care, is at 41%. But of course, persons can worsen or deteriorate and be managed at the ICU, or they may get better and go into the ward level care. The average of the HDU care is actually 79%. So it's quite a high average between the 1st of June and now. And this demonstrates, again, the severity of the COVID-19 virus. Now, the purpose of the parallel healthcare system, and one of the reasons, was to preserve the traditional healthcare system so that the best quality of care could be allocated to persons who did not have COVID. So it was really operationalized or activated to save lives of persons who do not have COVID. And one of the indicators that we use would be the number of COVID-positive patients in the major accidents and emergencies across the 4 RHAs. Of course, you are moved when you are suspected of being COVID positive from the traditional system or the RHAs into the parallel healthcare system. Yet again, there has been a consistent decline, and this morning the NC-RHA across 3 A&Es had only 4 COVID positive patients, the NW-RHA across 2 7, the SWRH across 4, 3, and the ERH at the San Grande Hospital 2. We also look at the percentage or how many ambulances of the total national ambulance service are required to move transport or to transport COVID-positive patients from home to hospital or between hospitals. And there has been yet again a decline over the last week, on average about 30%, meaning 3 out of 10 ambulances are required to move COVID patients. We also look at the time, and of course this is important in terms of the response time, which is the time span between the call for the ambulance and when the ambulance drops the patient at the E&E and sanitizes and is able to return to service. There was a slight uptake, but on average over the last week we have noticed that the time span for an ambulance to turn around goes from 150 to 120 minutes. Ladies and gentlemen, the reality is that we continue to notice a slow and consistent decrease in the number of patients requiring treatment in our parallel healthcare system. While this is a positive sign, it must be emphasized that the decline is slow and the proportion of severe and critical patients is greater than that of recovering patients, which is 3 times. This trend clearly indicates the severity of the virus. In closing, and on behalf of every single frontline worker across several ministries, on behalf of the volunteers and persons in the public and private sector that have been working selflessly to manage the COVID-19 pandemic for the last 17 months, and who generally are becoming tired because we have really worked and managed patients on a 24/7 basis, I would like to leave you with a message of hope, resilience, gratitude, and perseverance. I appeal to you to adhere to the relevant public health regulations and practice the 3 Ws, which Dr. Trotman will extrapolate on, as well as to become vaccinated. Please go for your second vaccine shot as required. Don't miss your appointment without reason, and reschedule if you need to. These measures are our only armamentarium or our only weapon as we hope and as we give hope to manage COVID-19 and win the war against it. Of course, that involves a return to normalcy, which we all would like to have. I now hand over to Dr. Michelle Trotman, who will speak about the actual clinical status of the patients in the parallel healthcare system. Thank you very much.
Honorable Prime Minister, Ministers, Health CMO, fellow health colleagues and members of the team, to the team who takes care of patients, all of you out there, good afternoon, members of the media, members of the listening public. Dr. Pasram would have mentioned the exciting news, and we are in exciting times, that the WHO has approved a drug that we can use to help save patients, help manage patients who are critically ill with COVID-19. That drug is available, and I am actually very happy to report that CMO has approved guidelines that has allowed us to already administer drugs to this drug to one such patient. The drugs that we are talking about belongs to a group called interleukin-6 receptor blocker. It's something called tocilizumab. And it's a long word, it's a big word, but it's a drug that simply can be given once through the veins for those patients that the clinicians would select and can make a difference. The way it works is it acts to prevent inflammation. And that's a key buzzword that we always hear about with COVID-19, that one of the bases and the mechanisms that causes injury is inflammation. So this drug acts to prevent inflammation. As part of the advice that came out from CMO's office, I am also to remind that the ministry further advises the public that the following drugs have not received WHO approval for use, and therefore, in Trinidad and Tobago, they are not authorized in the treatment of COVID-19. These drugs are remdesivir, lopinavir or ritonavir, hydroxychloroquine, and ivermectin. I have been asked by the CMOs that we understand that's part of the media release, even as we jump on this additional new drug, that these other drugs are not authorized at this time. I want to take a moment also to just give a bit of an overview. We have been able to look at some preliminary information on the vaccination and mortality. So from June 8th to present, we have been able to review the files of some 300 plus patients, 341 patients. And to those families, I send my condolences to those families for the 341 deaths to date. Those patients, none of them had been completely vaccinated. We're sorry for the loss, but we know that we can help reduce further loss. Part of what we need to do is when that vaccine is presented to us, no matter which one it is, we know that it will reduce mortality, that number that I just spoke about, death, but we also know that it reduces morbidity, and that means how sick you will get. So it will reduce the possibility of you getting into the hospital. So not only mortality, but also morbidity. Just by saying yes to the vaccine and those that we are presenting to you, which are all WHO approved, all the research has been done, and we are bringing it to you. All you have to do is say yes when it comes to you. The other thing I want to emphasize is to remember that even while you get vaccinated, it doesn't mean that you cannot get the disease. And everybody will not be vaccinated at the same time. So there'll be lots of people that are still not vaccinated. So therefore, what do we go to? The foundation. The 3 W's. Wear your mask properly. Wash your hands properly. And remember, distance properly. Thank you.
Thank you, Dr. Chapman. I'd like to ask the Minister of Health now to take us through the vaccination program.
Thank you very much, Honorable Prime Minister. My colleagues, Ministers Young and Minister Hines, Chief Medical Officer and his team, ladies and gentlemen of the media, citizens, residents, all who are looking on the different platforms, a very good Saturday afternoon to you. So, my duty is to bring you up to date on where we are with the vaccination program. I think everyone is familiar with the layout of this slide, so let's go it through. Total first doses given out to date, 225,546. These figures are slightly updated from what came out in the press release yesterday afternoon. These are what we call the close of play figures yesterday. Across the RHAs, Northwest, 31,934. You can see it there. North Central, 48,851. ERHA, 28,552. That is the smallest RHA in terms of population, but the biggest in terms of the area that they serve. Southwest, which is the largest RHA in terms of population that they serve, 41,384. TRHA, 10,196. State agencies, 10,480. And other agencies like Supermarket Association, bankers, construction, security, CPEP, and so on, 54,149. to give you a total of 225,546. Total second dose to date, you can see it there. The key figure is the total second dose to date, 140,233, which is roughly about 10% of the population. But we need to get much more than that. And I want to echo what Dr. Trotman had just said. Get your second dose. So if we go to the next slide, which shows us our graphs, remember our first goal, which was predicated on what vaccines we had in stock. We estimated we wanted to vaccinate 188,900 persons. Fully vaccinated, that means 2 doses by July 31st, 2021. That is the horizontal purple line. The first dose, the green line, you would see we have gone above the first, the goal of 188 because we never stopped first dose. That was a possibility, but we always continued it, although now you will see the pace slowing a bit. But we have always continued our first dose program. The key indicator is the aquamarine line, the second dose. We are now at 140,233. So we have achieved to date 74.2% of our goal 1 of 188,900. Just to give you an idea of what happened over the past week. Last week, our first dose was 197,705. This week is 225,546, so it means we vaccinated with first dose, Sinopharm, 27,835. And I want to thank the population for really accepting the Sinopharm vaccines and also thank the people of the People's Republic of China for their assistance in getting us these vaccines. Our second dose last week was 68,944. This was the biggest jump. So last week we moved from 68,944 to 140,233. It means we would have jabbed second dose in 1 week 71,289,000 persons. So for this week alone, we would have between first dose and second dose jabbed 99,124 in 7 days. So we average about 14,000 jabs per day. What are we doing to encourage people to come out for their second dose? Because what we want is a close to 1-to-1 ratio as possible. For every first dose, you want a second dose. We have had between May and Wednesday, 9th June, done 15 interviews across radio and TV, the morning programs, radio, social media. You would have seen full-page ads in the newspaper explaining to persons what it means to be fully vaccinated. We have 15 more of these interviews scheduled across mainly radio, some TV, and we will continue our social media and newspaper coverage to encourage persons to get that 1-to-1 ratio. For every one person who was vaccinated with your first dose, come out and get your second dose, because fully vaccinated means 2 doses, and for those people who receive their second shot, you still have to wait 2 weeks before you consider yourself to be fully vaccinated. So we continue to strive to have that aquamarine line touch and hopefully exceed the horizontal purple line. I am confident that with the cooperation of persons, we are working very hard behind the scenes with all the agencies to bring out persons who have had their first shot to get their second shot. So that's where we are with the vaccination program, Honorable Prime Minister. So thank you very much.
Thank you very much, Minister Dayal Singh. Ladies and gentlemen, this is now approximately a year and a half since we have been engaged directly in response to a virus. You may recall that when we just started to take action in early March, having been informed about its coming the prior December, we were looking at a horizon of about September. And people started to say, this could go on until September. What's going to happen to us? September 2020. And soon after that, as we got to know more and more about the virus, and we saw its ravages around the world, people, including myself as a leader of a country, started looking at and listening to our technicians talking to us. This could last for a year. And then there were other people who were historians of pandemics were saying that it could take about 2 years before the human population gets the better of this particular virus. That's where we were in the early part. We initially took the position as a government to try to put a barrier between our population and the rest of the population of the world by attempting to slow down or to prevent the influx of the virus into our country. And that is the actions we took in the beginning were like that. And it went on for a while until we got to the point in early 2020. By the time we got to January of 2020, some countries were beginning to have access to vaccines. Certainly not 2021, sorry. Not our country, but some of the countries where vaccines were being developed had begun to either experiment on a wide scale, approve for in-house use, or grant some kind of emergencies. So by the time we got to March, CARICOM had put out a statement in January that we were foreseeing difficulties. One or two of our colleagues in CARICOM got access to vaccines as gifts in March, and we got our first access to a vaccine in April. If I run through where we are with the vaccine availability and accessibility now, it goes like this. We got 40,000 as a gift from India. We got approximately 67,000 from our 2 COVAX shipment that we paid for as our early COVAX involvement, expecting to get 20% of our population from that. So far, that's all we've got. From our CARICOM neighbors who had vaccines from their mother country and others who were not able to use them and they would have expired by the end of June, we got approximately 40,000. We've also got 100,000 from the Chinese government, and in our line of purchase from China, we purchased 200,000. And as I speak to you now, on the way to us, in the air on the way to us, scheduled to arrive here on Tuesday morning, is a shipment of 800,000 vaccines. All of that together means that we would have had or have available to us in hand just over 1.2 million doses. And these are vaccines that require 2 doses to completely vaccinate one individual. So as of today, we can look confidently at being able to vaccinate 600,000 people because we have access to 1.2 million doses. And of course, that is in the month of July. In this month of July, we are also expecting a shipment, or first shipment from Africa, of some additional vaccines, which could put us up close to the figure that we have been working with all along. Because at this point in time, a year and a half after battling with this crisis, the situation is that in the population of 1.4 million people, we are aiming to vaccinate 900,000 people. That is the target. If we are able to vaccinate 900,000 of the 1.4 million, our target would have been met, as a response triggering immunity in the population at large. The rest of the population that is not counted in that 900,000 are children and persons who might have got immune by virtue of being exposed to the virus during the period of the 2 years or thereabouts that the virus has been around. Some people would have got infected and would have developed their own immunity and not have had it triggered by a vaccine. But the statistically, and the science is telling us that if we vaccinate 900,000 people out of 1.4, one can consider oneself to have been properly immunized against the virus. So, vaccine-wise, as of today, we are a long way from where we were in April, because had we not got those first initial gifts, very small quantities, there would have been no vaccine in the CARICOM. Had we not got the small quantities of purchasing that we were able to do, we would have had no vaccines. That might sound a little difficult to absorb, but the facts are that as of today, 70% of all the vaccines produced in the world, 70%, have gone to a handful of rich and powerful countries in the world. And a larger human population, all those countries that are regarded as lower middle income and lower income, have had access to less than 1% of the vaccine produced in the world. That is the fact. So in that scenario, we can now say that we have escaped from a situation of hopelessness to one of hope. And not just hope. We can shift our policy quite considerably. Because in the absence of vaccines or vaccines to come, the most that we could have been doing was shielding ourselves from the virus and its infecting of the population. Now we can say that we are in the process of vaccinating our population. It started relatively slowly, largely dictated by the small doses that we had, 100,000, 200,000, and so on. But now that we, as of Tuesday morning, we will have that significant amount of vaccine. We are now in a position to vaccinate 400,000 people. So, given the time that it will take to get those shots into arms, it means that, relatively speaking, persons who require to be vaccinated in the immediate days ahead and weeks ahead, we should have enough vaccine to keep you vaccinated. That does not mean that all of us should descend upon a location and create a problem. We are saying that there are vaccines available and the Ministry of Health is prepared and ready to conduct a program of continuous vaccination, aggressive vaccination, because the quicker we get these vaccines into people's arms, the better for the population. And this particular vaccine requires a booster 3 weeks later. So we can go into first dose from next week, Friday, I think, next week Friday. From next week Friday, there will be a huge effort of mass vaccination to take place. And 3 weeks later, we start to apply the second dose. So during the month of July, this country would be significantly vaccinated. And then we look forward to August supplies to come from Africa and September. And those supplies will take us above the level or approximating the level of our target of the 900,000 people. So the restrictions of doing it by age at the upper end or by running out of vaccines from the main supplier, the Ministry of Health, that would end in mid-July. We now have vaccines. That brings us to the point that the vaccination program is voluntary. It is voluntary. And therefore, those people who understand, and I'm saying here today, after a year and a half, there should really be no person in Trinidad and Tobago who does not know that we as a people are in a pandemic, meaning that there's a virus out there that could infect us, and it could make you sick, and it could kill you. I don't know there's anybody in this country who's paying attention who would not know that. So the next step is, how do you respond to it? I am happy to report at this time that there are significant numbers of people in this country who are accepting that the response to this virus now is to do what we had not done before and could not do before, which is to vaccinate the population and get as many people as possible triggered in their bodies a response so that if the virus infects them, they would not get too seriously ill and they would virtually eliminate their chances of dying. Looking around the world where the vaccination program have been well ahead of ours is one thing coming after the others. You can learn from what happened to them. In all the countries that we are observing, the cohort of the population that has been vaccinated has been responding much, much better to the virus than the cohort that has not been vaccinated. In some situations, there are large populations that are vaccinated and from which they have observed, even when infections take place, there have been no significant death resulting. But in unvaccinated populations, the situation remains the same, where significant numbers of infected people get seriously ill and many of those people die. Today, I want to say to the country that we've traveled this path together. It's been very, very difficult. From an economic standpoint, it has been virtually disastrous. From the personal standpoint, for very many people who live at the edge of the economy, it has been extremely difficult. And for some people who lost family members, it has been extremely painful. But now that we are in the vaccination stage, we are not in the same position as we were a year ago, or 6 months ago, or even 3 months ago. We now have a choice to make. And therefore, the public policy has to shift. The government cannot isolate or take it upon itself to isolate individuals in this country. If the individuals in a situation of vaccination by volunteerism, if such a person decides, I will take a chance on the virus and not take it on the vaccine, that is the individual choice that you are making. That is not a government choice. Today I want to declare that notwithstanding all the abuse and the misinformation and the misunderstanding, the government of Trinidad and Tobago today has done what the government set out to do, which is to provide the population with the vaccines that are required. And the population is now required to use those vaccines to protect itself on an individual basis. I want to thank all those volunteers from the private sector who have been working with the Ministry of Health in those vaccination programs that you've been seeing, vaccinating people across the country, because very many of those people who got vaccinated could easily have been people who would have been reported in the daily statistical expressions of people who were infected, and it could have come to a worst-case scenario. We have to continue. We are now going to ramp up the vaccination program. We're going to have the mass vaccination sites operate for many hours. The exact numbers will be told by the Ministry of Health. Those volunteering groups, I am sure I can still count on them to make that extra effort again and to do more than they're doing now. So by the end of July going into August, we should have a significant number, if not all those vaccines that are coming in on Tuesday, utilized in Trinidad and Tobago. We will then be in a much better position than we were any time before, or in fact, that we could have anticipated. Because remember when I spoke to you 2 or 3 weeks ago, in looking at these vaccines that we were working on to get into our country, I told you about the African vaccine, the African supply that may come sometime at the end of August. We've worked on that, and some of it is going to get here during July. We talked to you about getting about 300,000 out of China. We got 800,000. So we have significantly improved our access to vaccines in the last 2 weeks. And we're still waiting to see what may come our way from the United States. If any comes, then we are completely covered. If none comes, then we will wait to see how much we get on the other 2 streams. But we do have access now in a way that we never had before. And I think that allows us to move forward in making some decisions. Some that we anticipated before, some that we announced before, but the time is passing. Unfortunately, we have had no cause to reverse the projections that we have made. I did tell you that we would be opening our border, and some people are concerned about the fact that we kept the border closed in the beginning, and now we're opening it when there are challenges outside. Well, the same challenge that exists now with the Delta virus outside is the same frightening challenge that existed with COVID-19 in the beginning, the first variant, with the first microbe, because it was that level of a risk that we had to be taking. So in the beginning, we closed in response to what we knew then, and we had no vaccine, we had no vaccinated person, and we didn't have a body of data that tells us that this thing is not going to go away in September. It is more than likely that this virus would be attracting our attention for years to come. We are already being told by the scientists that revaccination is a possibility and a likelihood if we are going to remain healthy in the face of this virus. Those are the kinds of discussions taking place in scientific circles now. So having got vaccinated in 2021 does not mean that you, like yellow fever, you're good for life. It may very well be that sometime later on, we may have to respond again to a variant that is so virulent that it requires a response quite different to the vaccine that we've used in 2021 or 2022. So we leave that for the future. But now, right, we are taking steps to make sure that the virus is in our community. Fact. We can do something about it. Fact. We can be better able to respond to it. Fact. But that decision is now yours. It is being said, and I couldn't agree with it more. It is being said that it is time to start letting people make their own informed decision and be guided by the Ministry of Health, because it is not feasible for the Ministry of Health to take it upon itself now in this scenario and say, just give us the opportunity to tell you to stay home, to stay away, to shut down, to lock down, and we'll protect you from the virus. We're not there. We are at the stage now where that individual decision and living side by side with the virus is where we are at. Make the decision to protect yourself by getting vaccinated unless there's a very good reason. I know there are some people who have a good reason not to be vaccinated because of what the personal situation is. But if the situation is simply because you hear somebody say something about Bill Gates, or you hear somebody say something about vaccine is the Holocaust of the apocalypse, please, for heaven's sake, don't put us through that. Yeah? We've been living with vaccines for the longest while. The vast majority of our children for the last decades have been vaccinated to go to school and stay safe. Many of the dreadful diseases that our children would have faced had they not been vaccinated are not with us. Because part of being a mommy or a daddy here, a child is born, you go to your pediatrician. One of the things that is a standard action is that the child has to be vaccinated along the way. And it's compulsory to get into school. This is no different. Except that we want to be able to have our population get back to work, even as we are keeping an eye on a virus that is still dangerous. So, ladies and gentlemen, we would set about to continue our reopening, because remember, in May, we had a very bad situation, frightening curves, steepening curves. I think the highest number of deaths we had in any one day was 25. And then we had very many days of teens, a few days of less than 10. We would like it to be 0. But the reality is that the virus is with us. And it is likely to infect some people. And statistically, we may get mortality out of that. But we like to minimize it. Minimize, minimize, minimize. And protect yourself at the individual level. We've opened up the construction sector last week. People have come back out to work there. Approximately 40,000 people in various jobs, 45,000 people I'm told, in various aspects of the construction industry come out. So while our policy had been to keep people from congregating, away from others, we've brought out 45,000 people, not to congregate, but to do productive work, to earn food money, earn a living, to pay their bills, but at the same time, doing it sensibly to minimize the possibility of getting infected. Today, I want to prepare the population for doing much more of that going forward. During this week coming here, the Ministry of Health will tell you how it's going to go about getting those vaccines as quickly as possible into arms. And the next big group of people that we would try to get back to some semi-normal arrangement is the food establishment and restaurants, itinerant and non-itinerant businesses, curbside pickup and takeout, deliveries and drive-through only. And we would like to begin that on the 19th of July. Today is the, so you have a week to prepare and to come out smoothly. And ladies and gentlemen, it is for good reason why we start this on Monday and not Friday or Saturday. I would love to have announced Friday, but I know exactly what is going to happen. And I know my people. And from the experiences we've had, we want to avoid the effects of the euphoria. Take it slowly. So when we open up the restaurants and food service, I know you're missing the doubles. When you go in the line, remember, stay 6 feet away from the person in front of you. And wear your mask. And have clean hands at all times. Those are the conditions under which we are going to be living going forward for a while. And of course, we are going to allow from that same date members of the public to engage in restricted outdoor activities, no team, but groups of 5, under the same conditions, group of 5, mask, not hugging up, outdoor for exercising in public spaces. Immediately, in keeping with the requirement to survive, we are going to allow, starting on Monday 12th, the reopening of retail establishments for car dealerships. So motor vehicle sales will return from Monday because it involves buying a car doesn't involve crowding, and we add that to the list of things we can do. So we have a week to prepare for major reopening of our economy, because once we go back to the food service, tens of thousands of people will be interacting again, and you add that to the construction workers, and you'd see that we are, in fact, exposing more and more people in parallel to the major vaccination program. The vaccination program we expect to go ahead at full speed. Yes. And it is my expectation that by the end of July, when I speak to you at the end of July, we would be talking about further significant removal of restrictions. That leaves us to hope that August will be back to some semblance of what we knew before May. And that is the program going forward. We have a more detailed program, but for now, that is where we're at. We expect that those persons who are in the groups, which I have not mentioned, you will be anxious to come out. Just believe me when I tell you, we are anxious to have you out too. And we will make that decision as quickly as we can. And we're asking just for your cooperation. Hold it a little while longer, and we expect, thankfully, the vaccine supply has come to pass in July, and therefore the reopening of the sectors will come to pass much earlier than we were facing had we not been successful in getting a good stream of vaccines. So that is it for now, and we will take a few questions going forward. Oh, I must tell you, I mentioned the border opening. The border opening that is going to take place, the relevant ministries on Wednesday will have a launch of that. It is going to happen on the 17th of July, but on the Wednesday is the 14th. On Wednesday of this week, there will be a major presentation to the country of Wednesday 14th. There will be a major presentation of what is going to happen on the 17th and how it's going to work. We have put things in place for the digital involvement of a digital program, and the physicals at the airport are ready. There's a confusion taking place about Tobago, which I don't understand what the confusion is about. The country has decided that we will have one entry point because we are, as part of the border opening, we are going to have state-supervised quarantine out of Piaku. We did not put a provision like that in Tobago for the simple reason of the logistics, and we are going to be able to manage that internal flow better and more effectively through Piaku. Tobago Airport is open to international traffic and international business, but only to vaccinated nationals and vaccinated non-nationals. The country is not open to unvaccinated non-nationals. So vaccinated nationals coming home can enter through Tobago or through Trinidad. Unvaccinated nationals are required to come through Piaku. I thought that was simple and straightforward. But I'm seeing maybe persons who were not properly informed, they didn't understand. But there is no other version. That is the version. The two airports are open in the context of what I've just said. And that, I think, and if there are any complications to be explained, the relevant departments and ministries will deal with that. So, your questions now, if you have any. It's quite okay to have no question.
You have a few. I have about 10.
We'll start with one question from you, and your colleagues will flow, and then we come back to you. You have a book.
We'll start off with the vaccination.
Identify yourself, please, and
Jess
your
Loveland with the Newsday. I apologize.
Newsday, right?
With the vaccinations, the last time you spoke on vaccinations coming from China, you said that we had ordered 500,000. We received 200,000 and we were expecting 300 more. Now we're hearing of 800,000. When was this shift made?
It was made since I last spoke. Because we always knew, you see, we were placing orders expecting vaccines to come from here, to come from there. What if it doesn't come? And it's a good thing we've done that. What we had was a line of purchase. You may recall I did mention to you that we were expecting vaccines in August and COVAX in July. The COVAX has now said not until August. We worked on, since I spoke to you, what we're expecting end of August, I just told you might be here in mid-July. So it's a fluid situation. So as we bought vaccines from China and not getting from elsewhere, we increased the size of that order.
Cost of the vaccine?
The price per dose has not changed, but I couldn't give you the exact figure now. The Ministry of Finance can give you the exact figure. You got the exact figure?
It's under non-disclosure agreement.
Oh yeah, that's another thing with these suppliers of vaccines, from whether it is all the ones supplying, in signing your contract to purchase, in protection of their market situation and doing business with individual countries, one of the things you have to do is a non-disclosure. Sign a non-disclosure of what you paid for it. You don't sign it, you don't get it.
Drew Brown, TV6 News, Prime Minister.
Yes, Drew.
Wondering, in the context of the United States and their vaccination donation as a group to the global community, do you think that, because nations like Trinidad and Tobago have this difficult balancing act with countries like the United States and China that may not have good relations with each other at particular points in time, do you think that is a factor given the amount of vaccines we're getting from China?
Well, the good thing about that is that Trinidad and Tobago has good relations with everybody. So wherever the supply exists, we are free to access it. We are not getting involved in other people's international relations. Trinidad and Tobago is a member of the United Nations. We subscribe to the principles that keep us there, and the international marketplace is not friendly to countries like ours. I mean, you would have seen the whole question, even though we all subscribe to the WHO as the umbrella body to give countries advice on matters of this nature, you're seeing countries taking the position as to what vaccines they would allow to make their list. We are not in that, simply on the basis that we are guided by WHO and it makes our life so much easier. So that's the world we live in. We are not going to get involved in taking part in vaccine diplomacy and vaccine hegemony and so on. If there are countries that can do that, that's not our call. But we as a matter of fact, the reason why we were able to get so many vaccines from China is because of the good relationship that existed between Trinidad and Tobago and China for decades. This is not a new development. I mean, by some persons who would look at it in that context and say, why are we going off to China? China has been part of Trinidad and Tobago's progressive foreign policy since Dr. Williams' days. And therefore, that's what our story is. And the United States is our major trading partner. We have 250,000 people in the United States, our largest diaspora. 275,000 people in the United States are our citizens. So, luckily for us, we have friends on both sides of the oceans.
Also, Prime Minister, given the fact, as you had announced, in terms of the mass vaccination drive that is anticipated very shortly, the state of emergency had been extended by 3 months from the original date. The government has the option of another simple majority measure to extend it by a further 3 months. Is the government looking at that, or do you expect the state of emergency?
What I said in the beginning still stands, that we will extend it if we need to. If we don't need to, we don't. But as of now, that is not one of the decisions that we need to make now. What we need to make now are decisions to get the vaccines into people's arms. And the quicker we get a vaccinated population, the quicker those things will disappear off the scene.
And as the vaccination drive goes on, in terms of the curfew, as you're opening up other sectors, will there be further adjustments in terms of the hours
on the curfew?
Yes, sir.
Well, I hope not. Remember, the adjustments were in response to our June high numbers. So I hope we never get back there to have to do that.
I meant less hours, sorry, for the curfew.
Less hours?
Yes, sir.
As of now, we haven't considered reducing the hours, but we leave it so for the time being. And as I say, at the first opportunity to remove any of these impediments, we will do it. Yeah? So that the minute we see that we could do that without damaging the progress we're making, we will do it. Contrary to what you might hear from some people or read, there's no desire by the government to punish people or to punish the community. Everything we have done, you may not agree that it's going to work or it is working, but everything we've done, the purpose, the singular purpose, is the public interest. Yes?
Kelly Ann Brown Campbell, TTT News. My question is with regard to the new drug.
The new drug. Well, there's nobody up here who can talk about the new drug, right? So, Dr. Trotman, I shouldn't say that. There's one person who, but he's not allowed to because he's not the dispenser of that drug.
I could, but I wouldn't.
That there was one person who had actually been treated.
Yes.
What is the selection criteria to...
Critically ill patients whose
Second part of that question is the availability of the drug in Trinidad.
drug is available in Trinidad and Tobago. And I just want to take the opportunity to emphasize the fact that this is one of many drugs that we are using to help with inflammation. And to remember that the best way for us not to have to use this drug is not to get COVID-19. And the best way to do that is to use two things. Get your vaccine and continue to practice your 3 W's. Thank you.
Let me just add something here, which I apologize for my handwriting, which allowed me to not realize what I was supposed to say to you. The manufacturing sector, beyond food, beverage, and pharmaceuticals, the full manufacturing sector is now to be open. Monday. How could I miss that?
Mr. Lucas,
Manufacturing opens on Monday. So if you're in a manufacturing business, you're good to go on Monday.
Lucas Singh from the Trinidad Guardian. You describe the current economic standing as disastrous, but has there been any discussions taken place about what is going to be needed to recover that post-lockdown?
A lot of discussion. A lot. A lot of it is about the post-COVID period, but we're not seeing the post-COVID period yet, even with the vaccination. What we're working on now is, you would have seen us struggling to fund the response during. We are now working on the things we have to do to come back stronger. We don't want to come back to where we were. We're following the exhortations to build back better. The rebuilding is what is taking our attention now. But it might be, it's going to be a hard pathway. It's going to be a difficult pathway, but we are certainly focusing on that now. Now that we have got a better understanding of the virus, its effect and its reach, we've spent a lot of our resources surviving a year and a half. We are now in a position to begin to take serious look at where do we go from here. And you will be advised as we have decisions of that nature.
Have you been able to yet quantify the value of that loss, that 8-day lockdown?
Not yet. The work is going on, but the numbers are frightening. I was looking at some numbers yesterday, and the one that struck me was that developed countries have spent 20% of their GDP in responding to COVID. Now that is a frightening number. So we here in Trinidad and Tobago will have to do the same exercise. We're doing it now, and we will eventually tell you what we come up with for our economy. And I was hoping that by now we would have had, one of our universities would have had somebody who would have done that. But we do get more echoes than substance. But I would really like to see the work done to determine how much. But the report coming out of developing countries, that some countries have spent up to 20% of their GDP just in responding to COVID. So you can imagine carrying the rest of the country, and you add a 20% of your GDP because of COVID, what that would have done to your budgetary planning. You may recall at the height of COVID in England, the British government abandoned the budgeting process and literally just did what had to be done to stay alive, if you may call it that.
With regards to the non-disclosure agreement, I know not much can be said about it.
Loudly, please.
Yeah, with regards to the non-disclosure agreement with China, Guyana has revealed the cost of their
not with China. It's all anybody you go to. The minister can tell you. We got discussions with Pfizer in the early days, up to a point. Non-disclosure and more. That's only a part of it. Non-disclosure and more. We disclosed the price of the COVAX because that was a internationally public thing and there was no commercial aspect to COVAX. But the other prices, all the contracts come with non-disclosure.
Guyana also purchased Sinopharm vaccine and they were able to reveal their per dose cost. So I was wondering why we were tied to an NDA.
This is Trinidad and Tobago, right? So let's keep our conversation there.
So Trinidad and Tobago was tied to an NDA.
If what?
Trinidad and Tobago was tied to an NDA.
Trinidad and Tobago what?
Was tied to an NDA.
Oh, tied to all the contracts, all the discussions we've had, that's the standard. As a matter of fact, even our discussion on the gifts with some countries started a non-disclosure. I was in the CARICOM meeting last week, and we had a situation where some people, not politicians, knew certain information, but they could not disclose it to the heads of government. You know what I'm saying? So here the heads of government were meeting, responsible for the populations in these islands. And our staff could not tell us what they knew because they were covered by non-disclosure contracting arrangement. So,
and just sticking in that same vein, in the interest of transparency, is the government considering buying through Guyana so that we be able to disclose?
No. You have another question?
Several more.
Yeah.
Prime Minister, I'm wondering, in terms of the Johnson & Johnson supply from the African medical facility, there have been reports concerning a plant in Baltimore coming out of the United States. I'm just wondering, has the government confirmed that particular supply was not in any way associated with that Baltimore plant?
We are not monitoring individual plants. What I do know is that the plant that the Africans platform is coming from, vaccines, at this point in time, are contracts being executed in South Africa with Johnson & Johnson. And whatever happened at that plant may or may not be part of the supply system to the Africans, but that problem would be dealt with before it can participate in a supply to Africa or to us, because it's under U.S. jurisdiction. But there's a production taking place. But our initial supplies are coming from South Africa, with supplies coming to them from Europe.
And also in terms of, still another aspect, in terms of the economic side of things, for small businesses in particular that have been closed due to the restrictions in response to the COVID pandemic, I know there is a loan facility that was announced, but in terms of any other forms of assistance, be it grants or VAT refunds or anything of that nature?
What we would like is for what we have offered to be utilized. We have made significant provisions. We both at the personal level and at the corporate level. And what we are disappointed in is that at the corporate level, very many people either could not or would not utilize the facilities because there are grants and loans. Some people are only interested in grants. And we did make grants available where the state, you the taxpayer, could make those grants available. But we also made loan very, very favorable terms in loans. But there has to be qualifications. You can't just give away taxpayer money to everybody who wants it. What we have found, and I want to touch on a point here. You would have seen the other day in the weekly narrative on NIB that information was coming out about a large number of people not being on the NIB list. So when the government sought to give help to those who have lost their jobs, we had some difficulty helping those people because to qualify, they weren't on the NIB list, but they lost their jobs. Get my drift? What has been happening over and above everything else is that a lot of people have been hiring people and not reporting the existence of those workers to the National Insurance Board. That is showing up to some extent because these people are not making statutory declarations. You see, if you do that, if you're doing that, it means that you're not paying NIS for the worker, you're not making your contribution. In some instances, we have found situations where people have been taking money from the worker, purporting to do so for NIS payments, and not making that payment. There's one word to describe that. It's theft. We have found instances where workers come to the government department to qualify for the government grant, only to be told that we have no record of you at NIS. But the person has been working there for years. And of course, you say, okay, get your employer to just send a letter saying that you're an employee. Now the employer understands what's going on now and decides, I am not issuing any letter. And that puts the person in a difficult situation. Ladies and gentlemen, these things have to stop. And one of the ways of ensuring that these things are reduced, ameliorated, or stopped is to digitize this country's operations. The level of corruption in this country, petty to huge to humongous, can be seriously assailed by digitizing operations. Because what digital activity does, it creates an ongoing record of what has happened. Who has done what, when it is done, and where it is stored. And the data is easily manipulated, easily accessed. So the faster we digitize this country, the better we are going to be to cope with this. The Ministry of Finance could tell you a lot more than I will tell you now on this matter, but this is a serious matter. A lot of workers working for employers who flatly refuse to comply with the requirements of the National Insurance Board. And then the question will arise as to what level of enforcement takes place at NIB. Because apparently, in this country, the only aspect of this country's operation that is held nose to the grindstone is the government and the cabinet. Everybody else gets a free pass to do as you please. And then in the end, it's the government, the government, the government. But we have to understand, the government is simply another facet of the country's operations. Yes.
In that vein, as far as you are aware, anybody has been arrested, charged?
I don't want to go there. That's a matter for the police. But you can only get arrested and charged if somebody determines that a law has been broken and provide the evidence.
Well, you just described it as a theft, so I just wanted to know.
Well, that's speaking in general terms. I have not identified the thief. I just identified the action.
Sorry.
And the during the first lockdown, Trinidad and Tobago Mortgage Finance had given some leeway to people who had to pay their mortgages because they couldn't meet it. Is the government considering anything for people who can't pay their mortgages to Trinidad and Tobago Mortgage Finance in this round?
Well, as I said a while ago, the government has made public all that we thought we could do at the expense of the taxpayer. But we also maintain that there's a client relationship between the individuals and the agencies are part of the whole COVID response. If the clients die, it's like an epiphyte on a tree. If the tree dies, then the plant that's living on the tree will die. So these people who you are mentioning are very important to these banks, and the banks will do what they can do to make them survive and get over the hurdles that they're trying to get over.
Minister Fellow. A new drug, I wouldn't try to pronounce it, T1. I understand it's used for rheumatoid arthritis. Do we have enough in stock to treat both COVID and arthritis?
So as Dr. Michelle Trotman will tell you, and she could come back up again, this drug is to be used in very selective cases. So the short answer is yes.
But before you get too interested in that drug is not a pass. It is only for patients.
Yeah.
So that drug only comes into play when you are already a seriously ill patient. So you don't want to go there. You don't want to have to be relying on that drug at all. You want to be a long way from there. One, not infected. Two, vaccinated. If you get infected as a vaccinated person, you don't get sick, and you don't get to the stage where inflammation is threatening your life. That's where that drug comes in.
Now, that particular drug was also stolen from the St. James Medical Facility on Monday, or reported on Monday. Could you give us an idea as to how many vials, I'm not sure if it comes in vials, were stolen?
If you ask another question while I go to my phone, I may have it here. But let me check and see.
The other question pertaining to that drug as well,
yes,
is prior to it being given the approval in Trinidad on yesterday, I think it was. Yesterday, yeah, the press release came out yesterday. I was told that doctors have been asking for it to be approved since as way back as last week.
Yes.
Did any of that come before you?
Yes, so as the Chief Medical Officer indicated, once WHO signs off on it, we follow the science and we follow the evidence. So once WHO gave it the seal of approval, we went along with it.
And I was also informed that doctors were in fact using it prior to the approval. Did that come before you as
No,
well?
that wouldn't come before me.
Just wondering if anyone could assist with this. The issue of the resumption of commercial flights, as you said, the reopening of the borders as of July 17th. Is it strictly with Caribbean Airlines?
Open to
25.
No, it's not. Caribbean Airlines is just one of the airlines that will use the airport. Other airlines will make their schedules and do their commercial business.
In that regard, Prime Minister, in terms of Caribbean Airlines, you have it, it's to be restructured and so on. Is that the best model in terms of what may be a high demand of persons coming back to Trinidad at this time?
Well, the airline has looked at all the facets of its business, made its projections, and made the adjustments to suit. You know, their costs and their profits. One thing I could say to the owners, the people of Trinidad and Tobago, we own that airline largely. There's a small percentage owned by the Jamaicans. We have funded that airline, I think, to significant sums, just to keep it in existence for the last year and a half, to the point where had we not done that, as we now seek to reopen the economy of the country, we would have been doing so without that piece of the economy. Caribbean Airlines is a part of the economy of the country, and it needed life support from the Ministry of Finance. But during that period, those who are charged with the responsibility of taking the best technical advice in the business, did so, and made new arrangements to cope with whatever we're going into. And they've done so. The Cabinet has got presentations made by Carl to the members of the Cabinet. There was a subcommittee of the Cabinet. So we don't just take their word for it. They don't just come and tell us what they want. They're rigorously examined, and their proposals have to be robust. And it's only when the Cabinet is convinced that approvals were given. In the meantime, the Ministry of Finance has been funding the operation of an airline that was not flying, or largely not flying. And now that they're going to go back out in a new environment, which hopefully will see some significant demand, the information that we have coming from them and their experts is that they are positioned to deal with that. And as they go forward, they will continue to be mindful of the taxpayer exposure.
Prime Minister, if I may, so the number of vials stolen from St. James was 25. And the total value, because I did ask for an audit, a reconciliation of the total value of drugs stolen, it was 2.5 million TT dollars.
We have the value for that particular.
No, sir.
For a second, just to take you out of the issue.
I think so, yeah.
I wanted to know.
I just asked for the total. So I have an idea of the total value stolen.
I thought the more pertinent question, I thought the question you were going to ask is, who did it? Maybe you're not interested in that.
I can't say that.
Professor, if I can take you out of this for a second.
I think that we've exhausted the questions on COVID and its variants and vaccines and their programs. The Minister of Health this week has a very, very busy week. CMO and his team extremely busy, and all the volunteers who are in the vaccination program. This is a busy week, a busy fortnight, a busy month. And when I see you at the end of the month, I will tell you how well we have done.
We have a few more questions. We have a few more questions. But my colleague was asking one before.
Yes, who's that? Renuka, yes.
I was just curious as to whether there was any update through CARICOM as the assassination of the Haitian president.
No, we have not had any new information or any additional information. This has been a tragedy. Actually, I would say that we are still in shock, because only on Tuesday night our CARICOM meeting ended. I took it from here. I took mine from here, this building. And at the end of the meeting, the last item that we dealt with in depth was a continuation of CARICOM's concern and involvement in the Haitian situation. And we had our technicians helping us work in preparing a very strong statement, which you might have seen. That statement was issued on Tuesday night. And President Aristide was and his wife, Aristide, Jovenel Moïse, the very said night that CARICOM put out a statement on that Haitian situation, which we felt was spinning out of control. That was the very same night that the attack took place at his private home. That is a very eerie development for us. I've been in touch with most of my CARICOM colleagues, and I think we are all still in shock. And of course, President Moïse is known to all of us. It's one thing to read something like that in the newspaper about something that happened on the other side of the world or somebody you don't know. But to somebody who you sat next to, across the table, on a table, spoken to, it is kind of unreal for us. And to see that, as a matter of fact, CARICOM had tried to get into Haiti to have, greater involvement, hands-on involvement. But, in Trinidad and Tobago, there are lessons to be learned here. No matter how bad you think it is, it can always get worse. And differences of opinion ought to remain that. There are very, very strong differences of opinion in Haiti about their political situation. And the stoking of fires usually can result in conflagrations. And those of you who were following it, as we had to follow it, Haiti is a CARICOM country. Haiti is the most populous CARICOM country. They are a full member of CARICOM. But we are not as close to Haiti as we are to the Eastern Caribbean and so on. But the issue in Haiti started and never really stopped. It started with the inauguration of the president. And towards the end, the interpretation of the extent of his term. Because you may recall, when he was inaugurated, it was after a period of political difficulty leading up to the inauguration. And that started a question of what is the length of the president's term. And different people had different interpretations, and it just got from bad to worse until the streets of Haiti had become, virtually a battle zone. So differences of opinion ought to be differences of opinion because they can have serious consequences.
Any confirmation, Prime Minister, on the number of Trinidad and Tobago nationals in Haiti and how they are doing at this time?
I couldn't give you a figure, but I do know that we do not. The last time I checked with the Minister of Foreign Affairs, Foreign and CARICOM Affairs last few days ago, we have had no request of any national out there who requires assistance in getting out of any situation. And so far, it has not gotten worse. It's still bad, but it is improving. I've seen the Haitian government has asked for help, and I expect that they'll be getting that help.
I know we have questions on...
Yeah. Prime Minister, going back to the whole vaccine issue, have you received any clearance from your doctors to receive the vaccine? And when
I am hoping to get vaccinated this week. Actually, I have a conversation. I reached out to my doctor this morning, but that is the first time I've called my doctor and didn't get him. I hope I can get him during the day. But I expect to be vaccinated this week. And that is after my period of, I had to be in what do you call that? What? You have to wait 3 months. No, what do you call the period after when you get infected and you have to... if you ever get infected and confirmed to be infected, you cannot be vaccinated. That's what the scientists say, because you are now building up some immunity, and they are allowed to go. Initially, they said it was 6 months, and then later on, WHO changed it to just over 3 months. So I am at the place now where I can be vaccinated, and I'll be happily vaccinated sometime in the next couple of days or so. As soon as I get I have some guidance from my doctor, but I need some further guidance before. I hope it is not too serious.
Prime Minister, could you clarify, with the food and beverage opening up on the 19th, bars that sell food, would bars be allowed to open? The restaurants that sell alcoholic drinks, would they be allowed to sell curbside as well?
I am not going to comment on anything that the law doesn't say. The requirement's going to come out in law, and then the law enforcement will follow that, because I see the ingenuity of nationals, and I'm not at this point going to go down that road and say, well, you can't be this ingenious while you're being a genius. So let's see when the law comes out, it will say exactly what the law is, and then I leave that to the law enforcement.
Those who may be wondering about, let's say, going to the barber shops, the salons,
not yet. That is still very personal, and what we are doing, we are sacrificing some things for others. I want you to see it like that. We would like everybody to come out, but some people are not being brought out, and we consider them making a sacrifice so that others, for example, to allow those construction workers to come out, other people are being kept away, and we're trying to get them back out as quickly as possible. But we don't want to do what has been done, which is to open up too fast, get into big trouble, and then have the trouble to deal with. That's what we're trying to avoid. So while I understand, the pressures being put and the interpretations of some people. The bottom line is that we don't want to create a situation where the very opening up becomes the problem. Okay? And I may say, but don't take me other than what I'm just going to say. We're almost there. Right? So if we hold on a little while longer, doing it as cautiously as we're doing it, we expect to come out of it and not be exposed to a too fast opening up, causing a reversal. And then you start, the only issue that you're worried about now is how many people dead. Right now, there are some people not paying any attention to the fact that people are dying every day. In fact, some people are so ridiculous, they think that all they have to do is say the Prime Minister kill them. And that does it. But we're not going down that road. We are looking at the interests of the average person in this country. And we've paid a huge price to give everybody a chance to be here when it's all over.
Very quickly, Prime Minister. One, I know you talked about the launch on Wednesday, but in terms of whatever briefing you would have received, in terms of the Delta variant, the Delta Plus variant, there is a concern that with the reopening of the borders as you described it, we could be facing this major challenge with those variants.
That is true, but again, what we have put in place gives us the best available chance to live with it. If we stay here and say we're going to stay shut up because there's a Delta variant out there, which month we're going to open up? We have been closed now for 2.5 months. So even if we would like to be safer by closing the doors, we have to balance that against the requirement to get some activity going to be able to see the next month or two. So we understand that the virus is there, but there's something else. That is not the last variant. The virus keeps mutating all the time. So we have to be cognizant of that. It's good news that we are getting that most of the vaccines, or all the vaccines, are in fact responding well to some. We're getting information that some are not responding as well as they thought and so on. But that conversation will go on until it is determined what the situation is. So we just have to take it not just one day at a time, but situationally. I mean, we don't know. I have no doubt, as long as we are part of the world's population move back and forth, somewhere along the line it's quite possible that that Delta variant would get here. But then we don't throw our hands up in the air and say, well, we have to deal with it. And you would have seen, the Prime Minister of the United Kingdom. They were locked down in very serious ways for a number of occasions. And eventually the government is now saying, listen, we have to live with this virus. There's a lot that you could do. There's a lot that the government has done. And let us make it difficult for the virus. And we are basically going down that same kind of road. Make it difficult for the virus to infect and to spread and to also have this worse effect on an infected person. And that's what we're doing.
The issue of the licensing authority, I think, is that to be opened in terms of registration of vehicles?
Yes, motor vehicle registration. That is going to happen because there are a lot of... it's part of the Ministry of Finance business, and we need to get that business going.
And on that note, Prime Minister, this week there's been a conversation about the issue of exemptions for motor vehicle taxes for MPs and so on. Minister Young gave an explanation during a press conference earlier this week. As the head of the cabinet, I'm wondering what is your position on this? There was the issue of the timing of purchases by members of cabinet, that kind of thing.
How much time do you have?
As long as you have time to broadcast, Prime Minister.
Okay. Last year, October, this matter came up. And it was the subject of an editorial. It came up driven largely by members in the parliament, in the opposition. And I did say at the time, and I'm still saying it, that if the abuse that we had seen raised then is what is taking place, I would ask the Cabinet to consider whether there should be some capping on the exemption. But let's understand what the exemption is. The exemption is part of the terms of engagement of thousands, probably thousands of people. Different people have different levels of exemptions. There are 3 taxes that apply to motor vehicles. Some people get 1 off, some people get 2 off, some people get 3 off, depending on your terms of engagement. That is not a popular arrangement for some people. But those are the facts. But when I said I'd look at it, I did look at it. And I sought some legal advice, it being people's terms of engagement. The legal advice was that these are people's terms of engagement and you have no authority to interfere with it. Right? Because it would be quite unfair for me to interfere with it as Prime Minister for some employees of the state, what ministers are, and other employees are not. And there was no intention of the government to interfere with other people's exemptions. In fact, it was put to me that the Salaries Review Commission at one time had suggested that this exemption be capped for everybody, including judges. But that said a lot about the Review Commission at the time, because everybody who knows anything about judges and their terms of engagement know that you cannot alter the terms of engagement of a judge to his or her detriment. So that suggestion was just pandering to foolishness. Right? With respect to that, I have taken that advice, and I say this to the country today. I want you all to listen to me very carefully. I've been Prime Minister of this country for 6 years. I expect to be Prime Minister for a while longer. And one day I will not be the Prime Minister of this country. And the one thing I want to be able to say to the country when I leave this job is that I did not run a cabinet of corrupt people who sought to steal government money for their benefit. After 6 years, I'm on that track. And when it's ended, I hope to be able to say that to you. And it really galls me when persons who can't say that come in to take an issue about an exemption that is part of your terms and what you do with the money you earn. I could tell the country, no, I bought a vehicle because I drive myself. And as part of the terms of engagement for the job I do 24 hours a day, I accept the terms of my engagement. And if it displeases some people, I'm sorry. But I don't think it is fair for somebody to tell me what to do with what I earn when you have no interest in talking to those who have stolen public money. And you have no interest in that. Last year, October, this matter was raised as an editorial. Subsequent to that, I have not seen an editorial on certain members of parliament who, before the court, for stealing public money in the ways that they have done it. I haven't seen that yet. What I've seen, though, is that such persons go in a big warehouse and trying to feed people. Probably with the very same money they have to answer for in the courthouse. That doesn't make the news. But I see the press interested in a comment from a member of parliament about minister's car, including my own, that bought with my own money, when that same member of parliament was re-elected without losing one vote. After a judge read out a judgment for 3 hours, and that individual's name was called 113 times in that judgment. and still before the court to account for taxpayers' money. Hundreds of millions of dollars. And you're interested in my car that I buy back with my own money? And of course, in the intervening period, this government reported to this country, and let me tell you some of the things we reported to you. The people who are pushing this for political benefit, because that's the whole idea behind it. There was a Benz bought in the HDC for a minister to drive. That wasn't part of the minister's terms. I heard that same person saying that I said that in my government, no minister will buy a luxury car. I said no such thing. Because it was never my intention to tell ministers what car to buy. What I did say is that no minister in this government would be using taxpayers' money to buy a luxury vehicle for the minister to use. And the reason being is that the Salaries Review Commission has made arrangement for that minister to buy a car for his or her personal use. So in this government, there's no minister who is using for his personal use a car bought by taxpayers' money. There was one bought in the Ministry of Housing for the said individual. There was a Porsche in the Ministry of Agriculture for that minister who said Porsches drive better in mud. There was one who crashed a Prado, taxpayer Prado. And of course, I'm sure you forgot the 2 Range Rovers with the same chassis number. I don't see any editorial with that. So you're picking and choosing what is the issue. And I'm saying the issue cannot be the vehicle bought by somebody with their own money, when in fact you're giving a pass to people to even raise the issue. And coming to question me about somebody's say, and the very person who's saying it in the courthouse to answer for the money that they can't account for. Let me tell you all, just in case, since you raised it, let me give you an idea of what taxpayers in this country are facing. EMBD, which is a state company, EMBD, Estate Management Development Company. That company is currently fighting 4 Court of Appeal matters. 4. 20 High Court matters and 1 arbitration for claims against that company by contractors who had certified payments facilitated by certain persons in this country to the tune of $3.8 billion. That is what this government is dealing with. And people who have questions to answer about that want to talk to me through you about my car? You all serious? $3.8 billion of court matters, litigation and claims. In one matter, in this singular low-rank company, doesn't earn a cent, just spending taxpayers' money. The claim was for $532 million. It has been settled for $28 million. Have I earned my keep? Can I buy a car now? The same people who are raising the issue and chaining you up now to make this an issue in this country have not responded, and I have not seen an editorial about $921 million that was signed away on the 5th of September, the last working day of the last government. They're still in the parliament, waiting to come back. And they need your help to raise issues about car, Queue up roundabout. We built it for $225 million. This government built it for $219 million, as a matter of fact. The contract was for $225. It was built under the contract price at $219 million. That was a $500 million project. As I speak to you now, our 2 vessels have just pulled up alongside Stobles. One newspaper reported it on page 11. The other 2, not interested. But $277 million we can't account for. But the Dutch government is pursuing it, paid from Trinidad and Tobago in the last purchase of the diamond vessels. That doesn't make news in this country. And of course, I don't want to go in other details because a lot of it is in the court. And because the government is saying nothing, a lot of people feel nothing is happening or nothing has happened. But because the matters are in the courts, what we know we can't tell you because that now becomes another conversation. Because it would be easily said it is politics and people, undue publicity and whatever. So the government stays very quiet. But I tell you, if I was Prime Minister and there was anybody in my office who had to explain millions of dollars that they get it from contractors, I would let you know. You would want to know that. But it was the PNM, you would want to know that. You see? But let us just say for a moment that the terms of ministers remain their terms, members of parliament for that matter, and each individual will make his or her own contribution to handling the affairs of people that they represent. I've seen it said in one of the newspapers that one of the things that is lacking is that MPs are not doing enough to help their constituents. Well, that can be interpreted in a number of ways. But one thing I will tell you, I have no intention of stealing any public money to be able to give the public a truckload of food. I've not done so, and I don't intend to. I also don't intend to, and I do not make fanfare about what I do for and with my constituents. Out of my own pocket when I have to. As a matter of fact, on reflection, the single largest check that I wrote in any 1 month for my constituency business was significant. But I didn't make a fanfare of it. And when I add to the government support for my constituents in the food program by adding a few truckloads of food to that, which I either raise or buy myself, I don't make a tissue of it. Because my prayers are between me and God. But you don't accuse me of not being a praying man, because you don't know. And I'll tell you something else too. This country pretends a lot, right? And those of us in the PNM, we are held to a higher standard. And for that, we make no apologies, because we are the PNM. But I simply ask you not to expect me to spend too much time. I spent some time on it, but not to spend too much time on what car. As a matter of fact, I didn't even know you bought a car.
Well, apparently.
And you didn't know I bought a car either. Okay, Sharon, I'll tell you after. I will tell you after. You didn't know I drove myself, did you? I do.
This is outside of moments with special branch protection, Prime Minister. There are distinctions between the two.
I drive myself when I have to, and I like to. So I don't want to lose the skill. So, we have to focus on what really matters. And there are some people in this country who have no moral authority to speak to anybody but taxpayers' money. That calm matter you're talking about, no, you know how it arose? It arose because there's an allegation, which is now the subject of a police investigation, of a member of parliament facilitating that same exemption for a member of the public to buy a car with an exemption of $1 million. Did you hear me? A member of parliament under police investigation for facilitating a member of the public getting a vehicle and escaping $1 million in exemption. That came up in the parliament. I didn't say an editorial on that. It's police business, so I don't talk about it. We don't even talk to the member of parliament about it. Let the police do their work. Let the law take its course. But his colleagues who know that, coming to ask me about my car, that I could give the police a ride in. Let's get serious on serious matters. Let the law take its course. And let us say thank God on September 7, 2015, the public intervened to stop what I just mentioned to you. You know what I'm talking about? You know what $1 billion is? Huh? EMBD fighting $3.8 billion in the court for you? Because EMBD is your company, you know. It's a state company. If we lose that battle, you have to pay. We have situations, contractors come in with certified claims and say, okay, I'll write off X hundred million, give me the rest. And the people who did that, still in the parliament, waiting for the next election, and annoying me in the intervening period. You know what time I get up in the morning? I go to bed between 2 and 3 o'clock in the morning, and I get up at daybreak. And when I get up nervous many times. Because what's going to happen to us as a people today? And all of a sudden they're concerned about debt in the country. They're concerned about who's hungry. They're concerned about who's starving. They're concerned about... Just give me a break. Thank you very much.
School as we know it has changed, and your home must now be transformed into an effective learning environment. And JG and Friends Educational Systems can do just that. We are providing educational programs which are aligned with the Ministry of Education School Curriculum Guide. Our programs are the ideal tools to use for the blended learning and homeschooling environment. Students can learn from classroom video tutorials, gain knowledge